Your doctor believes it is necessary for you to have a CT or a CAT scan. The CT scan gives your doctor a better view of everything under your skin: bone, muscles, and internal organs. CT scan versus X-ray. A CT scan is a type of X-ray. However, a CT scan gives your doctor a three-dimensional image of your insides, while a regular X-ray just gives a two-dimensional image. The 3D image will help the doctor better understand and treat your medical condition. How is a CT scan done? As the patient, you don't need to do anything except hold still during the CT scan. You will be placed on a movable platform that will slide in and out of the CT machine opening, depending on which part of your body is being scanned. Contrast. Sometimes the doctor will order a CT scan with contrast. Contrast helps certain parts of your body show up better on the results. Depending on what your doctor is looking for, you could receive contrast through an IV, by mouth, or even through your bottom. IV contrast can cause you to feel flushed. IV contrast does contain iodine, so if you are allergic to iodine, tell your doctor. Oral contrast tastes like a chalky but sweet milkshake. Rectal contrast is given through a small rubber tube that is inserted just a couple of inches into your rear end. Are there alternatives to the CT scan? Each type of imaging machine has its advantages and disadvantages. For example, CT scans and MRIs both show a very detailed picture of everything under the skin. However, each test shows different tissue better. Sometimes a CT scan can be replaced by an MRI, ultrasound, or even a plain X-ray. If you are concerned about getting a CT scan, ask your doctor if there is a test that could be substituted. Risks of CT scan. A CT scan is a test that uses radiation. High doses of radiation can cause damage to cells in your body. Occasionally, this leads to cancer. A single CT scan is not a high dose. However, a CT scan is more radiation than a regular X-ray. For example, a chest CT scan is equal to 50 regular chest X-rays. Accordingly, you should avoid frequent CT scans because radiation dosing is cumulative. In other words, it adds up over your lifetime. Complications of CT scan. The IV contrast used in some CT scans rarely causes an allergic reaction. Some people feel a flushed feeling from the contrast, but this is not an allergic reaction. A very small number of people will have itching, hives, and even difficulty breathing. If any of these symptoms occur, you should notify the CT technician immediately. Diabetic patients taking oral medications may be at a higher risk of complications with IV contrast. Additionally, if you have any loss of kidney function, you might also be at a higher risk of complications with IV contrast. If IV contrast is needed, these complications can usually be avoided by being well hydrated. Additionally, do not take any metformin for 48 hours after the CT scan.